Thank you, Mr. President. I rise to commend the lead sponsor and the author, and my good friend from East Boston, Councilor LaMattina. I approach this issue as a city councilor, as an asthmatic, and as a youth baseball coach. This is an attempt to make sure that our parks are safe and healthy places for everyone that uses them. As a youth baseball coach, I'm at the parks anywhere from 3 to 5 days a week during the spring and summer months. And I heard sort of inside speaking, someone say, well, if someone lights up, you could just move. Well, if you're my third baseman, you can't move from third base. If you're my first baseman, you can't move from first base. And I've witnessed people smoke right next to my third baseman. He can't move. He's playing his position. Nor should he have to move. It's a 13-year-old playing baseball. As an asthmatic, I want to bring to your attention that the number one reason for hospitalization at our children's hospital is asthma. Those children live in the city of Boston. Those children use our playgrounds. They play in our football fields, our soccer fields, our basketball courts, our tennis courts, our tot lots, our softball fields. And we're saying those children shouldn't be exposed to secondhand smoke. Those families shouldn't be exposed to secondhand smoke. Many of us know, or our district councils know this, or our large council knows, that many seniors use the parks throughout the day. They shouldn't be exposed to secondhand smoke unless it's their choice to be exposed by it, as Councilor LaMattina mentioned. For those who think that this is outside, what can the harm be? Let me point you to no greater authority than the U.S. Surgeon General. In 2006, this was a conservative U.S. Surgeon General appointed by President Bush. And in 2010, the next administration Surgeon General all agreed on one thing. It's well established that secondhand smoke is the cause of serious diseases that include lung cancer, heart disease, heart attacks, sudden infant death syndrome, asthma, and other respiratory ailments. The 2006 report under the Republican administration said there is no safe level of exposure to secondhand smoke. So for those of you who think it's just a little bit, maybe you could just smell it. The U.S. Surgeon General said there's no such thing as a safe level of exposure. The 2010 reports that even a small amount of tobacco smoke in a short period of time can be harmful. And for those who wonder if as a city we can do this, I bring to your attention that according to Americans for Non-Smoking's Rights, over 400 communities in the United States have adopted policies that create smoke-free parks. And not to mention the fact that we all see them, the cigarette butts on the floor. We all see them. And we all know that that's a fire hazard. Everyone knows that. Why bring that risk to a playground where children are playing? And so I rise to say this is a hearing order, simply to look at the issue, to invite those who, both in opposition or in support, medical experts, academics, residents, parents, avid park users, people from the Chinatown neighborhood doing Tai Chi in the park, the young mothers from Charlestown are bringing their kids to the playground. Invite everyone to come here and explain what their thoughts are about this. And I get it. I'm a supporter of civil liberties. I understand the argument that if you want to smoke, you should have the right to smoke. It's legal to smoke in this country. I'm not trying to make it illegal to smoke in this country. I'm simply saying in the public space, in the public park, I'm looking at the rights of the person who's made the decision to not inhale tobacco and to deal with the health risk of tobacco. I know amongst my colleagues there are people who are allergic to tobacco. I know amongst my colleagues there are people who are asthmatic. Think about the rights of those park users and those who make that choice. So I thank you for what I know every one of you will be taking this as a serious issue. I appreciate you for that. And I appreciate Councilor At-Large for his leadership on this issue. And I thank you for the time, Mr. President.
Thank you, Councilor Arroyo. Chair recognizes